The scapulothoracic joint is not an actual synovial joint. And in fact, there's no bone-on-bone contact in this joint. It really is just a functional joint. And again, thinking of it as a joint allows us to better understand how it moves and how it contributes to overall shoulder complex functioning. So the primary motion that occurs at the shoulder girdle is motion of the scapulothoracic joint. And again, this is going to be motion of the scapula riding on the thorax or the rib cage. So the scapulothoracic joint basically is a functional joint. And we can see in this picture here how the scapula sits on the rib cage. Now, this picture doesn't have the muscles and so on, so we just see the bones. Obviously, there are a lot of muscles involved here and so on, and there's actually muscles that would sit between the scapula and the thorax or the rib cage as well. But at rest, at anatomical position, the scapula sits over the thorax, basically between the second and the seventh ribs. So again, that's typically its position, but then it can move fairly significantly on the rib cage, move quite a bit in three different directions. There are no ligaments holding these bones or these regions together. The primary force holding the scapula to the thorax first is atmospheric pressure, and then also it's supported by its connection to the clavicle at the acromioclavicular joint, and therefore at the sternoclavicular joint, but then also by muscles that provide some level of kind of tension to help hold the scapula in its position over the second through the seventh rib. The suction or the atmospheric pressure is basically the scapula acting like a suction cup. It is shaped like a suction cup, with it being concave on the side, the anterior side, the side that faces the rib cage. But let's talk a little bit more about how it's held in position and then also how it moves, because it contributes very significantly to the function of the shoulder complex as a whole, but primarily to the stability and the function of the glenohumeral joint. So the motions, I've mentioned these over and over, but again, just to highlight, the motions that are allowed normally at the scapulothoracic joint are upward, let's do them in this order: elevation and depression, which this guy's doing, right? He's shrugging his shoulders. That's scapular elevation. The scapula has slid directly upward on the thorax. So instead of being over ribs 2 through 7, it might be over ribs 1 through 6, or the top 5 ribs, and so on. There's a good bit of motion that the scapula can provide in a straight superior and inferior direction. So elevation would be when you shrug your shoulders. Depression is when you let gravity allow the scapula to drop back down. Upward and downward rotation is shown in this picture here. So if you were to raise your arms up out to the side, we then see the scapula move and kind of rotate around this red point here, and then the inferior angle moves away from the midline, which means the glenoid cavity starts to tilt more upward. Again, the socket that the humerus sits in starts to tilt more upward. That's called upward rotation. And then when you return back to a kind of anatomical position, that's downward rotation. The last motion is protraction and retraction, and you can see that in this picture here. This here, when you reach forward, the scapula moves away from the midline. That's scapular protraction. So the vertebral border of the scapula would move away from the spine. That's protraction. Retraction is when you pull your shoulders backward, you pull your shoulder blades towards the midline. That's going to be scapular retraction. Some books may call that, or articles, you might see that as scapular abduction and adduction, with abduction being away from the midline, adduction you add to something, so you move towards the midline. The motions that are most important, obviously I've already mentioned, and that are normal, so that upward and downward rotation, elevation, depression, and protraction, retraction. But there are a couple other motions that I want to mention. These are technically considered to be abnormal motions, but they may be normal for a person. However, They also can be indicative of muscle weakness or muscle injury or nerve injury, especially if seen unilaterally. So we probably have all seen people that can wing their scapula. That's shown in both of these pictures here. This individual, you can see the vertebral border of the scapula has winged out or moved away from the body, and you can kind of almost push into this gap in under the scapula. That's called scapular winging. This individual is performing a test that we would do potentially to see if they have scapular winging, where they do kind of a wall push-up. If it's bilateral, like it is on this individual here, that's probably normal for her, right? But if we see it unilaterally, or if the person didn't typically have scapular winging and now does, it tells me that we may have an issue. The muscle that prevents scapular winging is the serratus anterior. The serratus anterior basically sits underneath the scapula, attaches to the vertebral border, and then attaches to the ribs on the lateral aspect of the rib cage. So when it contracts, it pulls the vertebral border towards the thorax and keeps or prevents winging. So if a person has scapular winging, there's a potential that they have weakness in the serratus anterior or damage to the long thoracic nerve, which is the nerve that goes to the serratus anterior. I used to see this in ice hockey a bit when a person gets cross-checked in the back, hit in the back with a stick by an opposing player. That can temporarily injure the long thoracic nerve. It's fairly proximal in the posterior aspect of the body. And then they get a temporary sort of paralysis or weakness in the serratus anterior. And they get winging. And typically that's going to be on one side. But again, just interesting to note that that's what the serratus anterior does. When we talk about some of the scapular muscles, we'll talk about the serratus anterior because it's very important in stabilizing the scapula. The purpose of the thorax and the scapula moving in relation to one another are twofold. First off, the fact that the scapula moves allows an even greater range of motion for our upper extremity. So it enhances the total motion that can occur at the shoulder complex. About a third of the motion that occurs when we go to lift our arm up over our head occurs between the scapula and the thorax. The other 2/3 occurs at the glenohumeral joint. But the scapulothoracic joint and the fact that the shoulder girdle can move does some important things. First off, as I've mentioned before, and we're going to really talk about from this point forward, is the glenohumeral joint to a great extent is held together by muscles. The fact that the scapulothoracic joint moves helps to maintain the length-tension relationship of these muscles that hold the glenohumeral joint together. So the fact that the scapula moves make these muscles better at holding the joint together. To kind of jump ahead, we're going to talk about athletes that have shoulder instability at the end of this presentation. Often their shoulder instability is partially due to weakness in their scapular muscles and dysfunction in their scapula. So if their scapula doesn't move as well, it causes instability in the glenohumeral joint because we can't maintain as efficient a length-tension relationship in these muscles that hold the joint together. The scapulothoracic joint moving also helps to position the glenoid in a way, again, the socket that the humerus sits within, to hold the humeral head in place. In that previous slide, we saw during upward rotation, the glenoid points upward. That helps gravity hold the ball and socket joint together better. The scapulothoracic joint also is a great shock absorber. So whenever you fall on an outstretched hand, the muscles that hold the scapula to the thorax can help to absorb that force and absorb the forces of landing that can be very large when someone's tripped or knocked to the ground in an athletic activity. The scapulothoracic joint also allows us to, again, push ourselves up out of chairs and, again, raise the body. Whenever we're kind of using the armrests to get up out of the chair, scapular depression is the motion we're using, and we're using the scapular depression muscles to help get us up out of the chair. And then overall, the movement of the scapula on the thorax helps to enhance shoulder range of motion. If we couldn't move our scapula, we'd lose about a third to even up to a half of the motion in different ranges of motion. So very important that the scapula can move on the thorax.